Hello, and welcome to Speech Science 705. This is a graduate level course and will provide a challenging and rewarding gateway to an understanding of speech motor control. You'll be experiencing a hybrid model of instruction which will require an understanding of how to navigate Blackboard and participation in group lab work as well as face-to-face lectures. I look forward to meeting with each of you and bring the science of speech into your graduate studies as a pivotal and critical knowledge base for your growth toward research development and clinical practice. To begin, I would like to share with you a presentation given to the European Academy of Pediatrics on speech motor control in autistic spectrum disorders. We are now almost 2 decades past the decade of the brain, the last decade of the 20th century. And the diagnosis of autistic spectrum disorders continues to accompany a significant lack of clarity in both differential diagnosis and treatment options. This, in part, I believe, is due to the fractured nature emerging from several differing specialties dealing with the same disorder, the economics and political will of differing treatment agendas, and the funding of research and the focus of that funding. So in part, we're left with an age-old classic and often illuminating case study analysis. It is here that we will perhaps discover directions for research, the questions that arise, and the choices which allow allocating prominence to those issues which have a potential to make a significant difference in the life of children. Autism does not discriminate by race, ethnicity, economic status. It is pervasive in the lives of children around the world. It is often diagnosed in early childhood between the ages of 18 months and 3 years of age, the time when child development is met with expectations of increasing competence and motor milestones, the most challenging being the ability to speak, to communicate, to control the environment with sounds of speech, and to develop the language which in turn supports cognitive growth. The primary descriptors of diagnosis are concerns regarding communication, social relationships, and perhaps what is best termed a rigidity or lack of flexibility in play and routines of daily life. Underlying each of these, of course, is the neurophysiology of speech and hearing. Pediatric care of the developing child is critical for monitoring at the diagnostic level and assessing the effectiveness of a myriad of therapies provided once diagnosis is completed. In my clinical practice, the diagnosis of children encompasses a measure of cognition, speech production, speech perception, and language development. With each of these measures, it is possible to make a differential diagnosis within the spectrum. Some children may present with speech production difficulties while others with speech perception, and others with both production and perception challenges. Both these will impact the overall language development. The cognitive measures allow for initial states of cognitive ability and provides a prognostic support and prediction for the efficacy of treatment and developmental outcomes. The following case study was a child who was originally observed at 2.10, 2 years, 10 months, and therefore standard assessment was difficult, so certain measures were used to assess initial functioning, and treatment then proceeded from there. I look forward to sharing this case study further with you. The big question regarding this was how movements affect intelligible utterances across all languages is one of the questions in speech motor control. Movement in all its complexity is controlled neurologically and develops in the first few years of life. For most children, movements of speech occur seamlessly, albeit the terrible twos, when momentary frustration is evident. The beauty of speech production is that movement results in sound, and for scientists and physicians, this relation between measurement possibilities allows for a measurement, especially within the field of acoustics. The last half of the 20th century was met with findings describing events in speech production of normal speakers, including co-articulation, voice onset time, coordination of voicing, and the oropharyngeal contact, vowel duration and all its contextual variations. And also, in my doctoral dissertation, we explored the measurement of prosody. Each of these events, while described in normal, mature speakers, provides a standard for assessment in developing speech and disordered speech. We need to know the invariant qualities of speech production to move science forward to models which have a predictive power.